now. So for anybody who hasn't joined us previously, today is our meet and greet session with Citizens Advice Walsall. As always, these sessions will be recorded. We can't hear you, but obviously you can hear and see us. You can communicate with us, as always, through the chat function. So please ask any questions along the way, and we'll pick these up at the end. So today we've got Harshi, Jess and Michelle who are going to be joining us. They'll go through a brief presentation, and then, as I said, at the end we'll pick up any questions for you. Yeah, and I think that's all. Yeah, we'll make a start. So we'll pass over to the girls.
Good afternoon, everybody. So I'm Michelle Smitten then, and I'm the programme lead at CA Walsall, and I'm joined by my colleague Harshi and Jess today. Okay, if you want to go to the first slide. Okay then, so what are the aims of Citizens Advice? So it is to offer advice, and we provide advice to people to help them and support them with the problems they face. And also one of our roles is to look at policy, so to improve the policies and practices that affect people's lives. And we do this through campaign and research work. Next slide. Okay, our principles. So we provide a free, independent, confidential and impartial advice to everyone on their rights and responsibilities. And we value diversity, promote equality, and we challenge discrimination. Next slide. Okay, some of you may be aware that prior to shutdown in March, we had some flooding in our premises. So we had to relook at our services and how we were going to work from home to support the clients within Walsall. We have a long history of supporting the people of Walsall during times of crisis, and we wanted to ensure that we have a service that continues to meet the needs of our communities. Hence, all our staff started to work from home. Next slide. Okay, so just to give you a snapshot of what we've done since lockdown. So since March the 23rd, we have helped 1,161 clients with 9,551 issues. So I'm sure that can give you an indication of the complex needs of some of the clients that we work with, and often they present with more than one issue. And we have gained 553,000 of income for Walsall residents. Might be not surprised to hear that the 5 top issues for people living within Walsall were the benefits and universal credit, tax credits, employment, debt and housing. And of over 3,300 of these issues were to do with debt, and the top issue was council tax arrears. We're going to move on to the next slide now, and I'm going to pass you over to Harshi, who is our locality manager.
Hello, everyone. I'm Harshi Chauhan, and I'm the locality manager at Citizens Advice Walsall. My remit is to deal with generalist as well as our money advice service. So I will give you an overview of what we're doing. So when we had lockdown, we had to review our services. So our current digital services are as follows: advice line and callback, our welfare benefits casework, money advice service, BBO Family Matters project, and a help to claim service. I'd also like, tell you about another service that we've got, another project that we've got that's going to start on the 1st of September. Due to the pandemic, we received funding from the government and community lottery. And what this is allowing us to do is send a number of our advisors, train advisors, recruit advisors, train them and send them out in the community to deliver advice work to local people. And that is something that's really good for our service. So, there's going to be a lot of things happening with that. Can I have the next slide, please? Okay, so I'll start off with our advice line. So we're part of the national service, and it's now become the gateway to our service. Clients are able to contact this line by this number that's noted on the slide, and they will get full advice. Most of the clients that we advise come from Warsaw. But the good thing about this is that because we're part of the national service, if a client can't come through and speak to one of us, they'll at least get some advice and information from the national service. And the national service can then reroute them or actually email us with the client's details for us to contact them. Can I have the next slide, please? Okay. Now, we also have what we call callback system. We realized that there will be some clients when we went digital that simply could not contact us by the advice line. And these were vulnerable clients, or sometimes even agencies that needed to speak to us and refer clients. So we've got our switchboard, which is 01922 700 600, and clients can contact that line. The admin team will try and support the clients as much as they can, refer to other services. But where they realize, because they've got quite a lot of years of experience, that this client is vulnerable and really needs ongoing support, they will put them on our callback register. Can I have the next slide, please? When I talk to you about the gateway, our advice line and generalist callback is really important because we can then make referrals to all our other services, including our BBO Family Matters project, our welfare benefits casework, our money advice team, and help to claim team. But we can also signpost them to other agencies that may be able to support them more with the work. Next slide, please. So the kind of cases we're dealing with, say in March, we saw an increase on employment cases about COVID-19, about the lockdown, about the furlough scheme. What we're seeing now is a lot of employment matters, discrimination. We're still having the odd furlough scheme cases. Right throughout, we've dealt with family issues and DV, domestic violence cases. And what we've been able to do is to actually refer clients to agencies that can actually support them with the legal part of, injunction or things like that. On our callback, it's a little bit varied. We're having neighbor disputes to really specialist, detailed information about benefits, especially legacy benefits cases that they're not sure. I mean, I can tell you we had recently a case where quite a vulnerable client called us and was really distressed about the benefits and how they were going to cope, didn't understand when they were going to be paid. So our advisor took time out and went through the benefit system, calculated the benefits, ensured they were getting the correct benefits, advised them on their priority bills, and then informed them to come back if they needed any further support with that. So we've got quite a very sort of clients, both on advice line and callback. And what we were able to do is warn clients, if there's issues about you're going to get into debt, please don't hesitate to come back to us. So we give them information about the service as well. So next slide, please. So before this, I'll just talk a little bit about welfare benefits caseworker. We had too many slides, I do apologize. But our welfare benefits caseworker also is doing similar things that he was doing when we were face-to-face. He's completing forms, he's doing quite specialist appeals, mandatory considerations in respect of PIP, DLA, ESA, and we're finding that it's a new way of working and we're trying to really focus on how we can support clients. So that's working out really, really well. And we've had a few successes. Now, when we started with the digital service, the complete digital service, we noticed that we weren't getting as many referrals for money advice service. And this was also because the government had put in some transition support in respect of money advice. But we now know that money advice will grow because a lot of the transitional support is coming to an end, and people need to recognize that people are going to struggle if they're being made redundant, if they're not getting their wages paid, or there's been change of contract of employment where they're going to get a low wage, all those things. And our teams, especially on advice line, are continue viewing how, are people okay? Do they need further advice? Next slide, please. So there's different ways that we support. We try and do a holistic look, but there will always be clients that will just want advice on one debt. And that's not to say that we can't just give them advice on one debt. So what we do is we stabilize their financial circumstances, we complete financial statements, we look at income maximization, we look at, are they getting the correct benefits that they should be getting? We look at charitable assistance, and we give advice on debt relief orders and other formal insolvency options. And we look at their priority and non-priority commitments, and we engage with other agencies and organizations. Next slide, please. And like I said, our advice is tailored to the client's needs. Nowadays, most people, you've got 50-50 balance where people can, with a little bit of advice, you empower them and they can write to their creditors or they can contact their creditors. With others, you need to give a lot more support. So we always start from where are we? We look at capability. How can we support clients to manage their situation? And we also look at providing them with information, written information on how they can move forward. And it really helps because the client's got something in front of them that they can view and they can come back to us. We try and minimize we try and ensure that clients get the best sort of support they need. Next slide, please. So what we've got a live line for money advice service. So clients can contact this line, and it's linked to all our caseworkers' mobile phones, and they can respond to that. We've also got an email advice service specifically for debt advice, and clients can contact that service. Next slide, please. What we've also thought about is that we know that agencies want to refer to our money advice service, and we've put in details of our admin support that they can contact for appointments. So we're doing digital appointments. We're trying everything to make sure that we're reaching those communities that really need, and those clients that really need the support. Next slide. So we've put together a case study, and this case study demonstrates what the client came to us with. He had lost his job. There were lots of various issues, concerns about his universal credit, and he had an IVA which had been terminated. Can I have another slide, please? Okay, so the client was struggling with addictions, though he was getting some support in respect of that and mental health. And, he had debts of about £13,000, not sure where to go with this. And so, sorry, next slide. So the caseworker took time out to discuss holistically with the client what the options were, discuss budgeting and stabilizing his situation. Discretionary housing payments was applied for, and we were really successful for this, meeting rent payments for 2 months. We also arranged a food parcel from a local agency as he was struggling with food and relying on relatives. Next slide, please. And so when we went through the advice process, we also support the client with a DRO, and this really helped his situation and improved everything for him. Next slide. And so his universal credit was leveled off, his DRO was in place. So really for this client, it showed really good progress in a very short period of time. And so this was one of a really successful case for us to deal with. Thank you. Next slide, please. So if you have any questions, if you want to consider us taking on a referral, please do not hesitate to contact me. You've got my details and my email address. That's me done. Thank you very much.
Hello, so my name's Jess Bailey and I'm the project coordinator on the Family Matters project. Next slide, please. So the project is a project funded by the European Social Fund and the Community Fund. We've been going for about 4 years now, and the project isn't due to end until 2022. So our project supports participants who have advice issues that are affecting our ability to be able to engage in either volunteering opportunities, education or employment opportunities. On average, our participants that we support have 5 separate advice issues, and they are the top 5 themes that we see across citizens' advice. So they will all have a benefit issue, employment, housing, debt, and often an immigration issue. We support a lot of new communities on the project who have been accessing our support because of Brexit and the changes to do with European laws. Our participants, we work with them on a casework basis, so it's one-to-one confidential advice sessions. In the first session that we support the participant, we do a very detailed action plan. So we look if there's anything affecting their health, their employment, education, housing, their family situation. Interestingly, with Family Matters, the definition of family to be supported on the project is very broad, so it can be a single person. They don't need to be in a traditional family setting. It can be just a single person. So we work with the participants through these advice sessions, and we set both short-term and long-term targets to reach. So it might be immediate action we can resolve in the first few interviews, but obviously there might be long-term goals that we need to work with over a series of case one-to-one advice sessions. What we also do on the project is that we look at the data trends of what we're supporting people with, and through that analysis of the data, we also look to deliver group workshops for our partners. So, for example, we were working with the Prince's Trust, and we noticed that a lot of young people we were supporting were either not having very stable employment situations, or they were being dismissed from employment quite quickly. And from what we realised working with the young people was that they didn't understand what their rights and responsibilities were as employees. So we did a really fun interactive session with young people to sort of engage with them about what it means to be an employee. So hopefully that gave them more stability when they did become employees. Next slide, please. So the project really supports hard to reach and vulnerable participants. So we work with a lot of single parent households. Obviously, to be entitled to support from the project, you have to be unemployed or economically inactive. What we have noticed is that working with a participant, we get to understand their whole family situation, and very often we're working with participants who are like 3rd generation unemployed, where perhaps their parents have never been in employment and they just don't know how to navigate the way around it, really. We work with a lot of people who have long-term health conditions as well, that perhaps because of the changes from legacy benefits to universal credit, they're no longer entitled to the benefits they were on previously and therefore have to look for employment now. So again, it's about guiding them through that process and the changes that they need to go through. We work with a lot of survivors of domestic violence, and we also, the age range of who we support is very interesting as well. It's very equal across the age range. We have a lot of people who perhaps traditionally are approaching like 65 and looking towards retirement, but because of the changes in retirement age, they're still having to find that employment for an extra year or two. So we work with a broad range of age ranges. As I say, we work with a lot of new communities, and we work with a women's probation team. So we work with ex-offenders, and we also work with CGL Beacon, and we run sessions from their venue as well. Next slide, please. So The next 3 slides are case studies. I won't go into detail with them. I think it's best for you to have a little read of what we actually do. But across all three case studies, it's about getting a picture of what the actual family situation is and picking out and prioritising what we need to work with the families about. Obviously, a lot of there's initial immediate action that needs to be done with a lot of them where there's no income coming in or there's a domestic violence situation. So we always will deal with the priorities first of all and then look at the long-term goals across the interventions we do. Next slide, please. So this is a little bit more information about the sort of workshops that we do. As a follow-on from the workshop we did with the Prince's Trust about who wants to be an employee, we did that in the style of Who Wants to Be a Millionaire, and it was like a quiz that we got the young people to go into groups and answer. It was quite fun. From a follow-on from that session, we did a budgeting session about how to manage your first wage. And what we did is we gave the young people an envelope full of bills, as you can see, a shopping list, their first wage slip, and we worked with them about how they balance their incomes, how they can manage their income and reduce expenditure, and obviously live off the wage that they now be receiving. Other sessions we've done, we've recently done one about a redundancy workshop, so people who may find themselves redundant because of the current situation. It's a way of helping them navigate what their next steps are and to make that transition from, unfortunately, unemployment to employment as fast as possible for them. Next slide, please. So to refer to the project, we've tried to keep it as simple as possible. So to be entitled to support from the project, they must be unemployed and they must have the right to work in the UK. There are other sort of hurdles that we have to jump through as advisors, in the sense that the participants need to be able to provide evidence of their identity. So that's usually a passport, an ID card or a birth certificate. But we gather that evidence from the participant once we're working with them. To refer to the project again, we've just kept it really simple. You can contact us on the telephone number there, or just email us the name and number of the participant and we will contact them, triage them to make sure they're entitled to support. If for any reason they weren't entitled to support from our project, we'd still give them assisted information and signpost them in the right direction. Next slide, please. Yep, so my name's Jess Bailey. I'm the project coordinator. So if you needed to contact me, you can reach me on those numbers or that email address there. Thank you.
Okay, so this is a very quick whirlwind tour now of the Help to Claim service, and then we'll open up for any questions. So next slide, please. Okay, so obviously, as you're aware, universal credit was the biggest ever change to the welfare system. And it's important that we have the right support in place to help people navigate these changes. So it's a national service supporting people to make a universal credit claim. So Citizens Advice Walsall are part of this universal credit, and we're called the Help to Claim team. And we have 2.7 whole-time equivalent staff, and we are commissioned to support 2,008 clients per year. Next slide, please. Okay, so how do we support the client? We make sure that it's the right benefit for them. So obviously we do QBCs with them to make sure they would not be worse off. We access their needs and we gauge the level of support that they need. We tailor the support and we complete universal credit claims based on that client's need. They need ongoing support to signpost them or refer them into ongoing support with other organisations. Next slide, please. Okay, how do they access the service? We get referrals from job centres and we actually work within the job centres, so people can just drop in and talk to us. Unfortunately, that's not allowed, we can't do that at the moment. We get referrals directly from the council. Clients can always self-refer themselves in, and we also get referrals from our support agencies that we work alongside. Next slide, please. Okay, so I'm not going to do this today, but obviously, like Jess, there's a case study on here if you'd like to have a look through it to see how we support people to get the best outcome. Next slide, please. And again. There's some pictures of our lovely staff at a recent event. Next slide, please. Okay, so Ditesh Patel is our supervisor at the Help to Claim team. Any questions or you wish to refer any clients into us to support with universal credit claims, then this is the person to contact. His number and email are on the slide. Thank you. Next slide. Okay, so obviously research and campaign pandemic update. Next slide, please. So during the pandemic, we've been looking at data from 2019 and comparing it to 2020. So the final slides are giving you a little bit of a snapshot of what we've encountered and what we've observed during this pandemic. I'd encourage you all to try and read when you've got some time, because it makes some really, really interesting reading. So if you just want to carry on just showing a snapshot of these slides, keep going. Yeah, we've done gender, and the next disability, a sample ward analysis. Then we brought this data together, so a data analysis, and then a summary. Okay, and here is a little snapshot of how our switchboard was working and the sort of calls that we were getting between the 23rd of March to the 23rd of June. Next one, please. Okay, and obviously some of you may be aware that we celebrated our 80th birthday last year, so we're 81 this year. Next slide. And that is us. Thank you. And has anybody got any questions for us?
Hi, I'll just have a quick look through those questions. So we have had one question, which is, are you able to provide a translator for those that need it if English is not their first language when they attend for support?
Yes, we have a contract with Language Line, and so if you have any clients that need translation, then we are able to get support for that. We are also able to get support for people that are deaf. So obviously we have a signing service as well that we can use in order to support the client.
Okay, and that's all we've actually had at the moment. So we'll just give it a couple of minutes in case anybody else wants to ask any other questions.
Fine.
But otherwise, we will send out, as Lorna's already said, we will send out all of today's slides with all the contact details and on how to get in touch and how to refer into the service. Yeah. Yeah, so there's no other questions coming in.
Okay.
So I think you've answered everyone's questions in the presentation.
Ooh, just in time as well.
Oh no, that's perfect timing. Again, as always, today's session has been recorded. It will be available after today on the Safeguarding Partnership website. So if anybody has missed today's session or just wants to go back and recap, you can go on and watch it again. But as we said, we'll send out the PowerPoint and everyone's contact details will be available in there for you. So at that, I can only say thank you very much for joining us. Yeah, and that was lovely.
Okay, thanks for listening, everybody.
Thanks.
Thank you.
Thank you. Bye.